Hi, I'm Dr. Jeff Jacobs. A lot of people have difficulty taking eye drops, and there is a right and many wrong ways to do it. This video will teach you the right way to take eye drops and give some tips for people who have a hard time doing so. First, when you should take your eye drops. If you're supposed to take more than one type of drop at the same time, separate them by 5 minutes or so. This lets the first drop absorb before it gets washed out by the second drop. Most eye drops come in bottles that have a screw-on cap. Once you unscrew it, you need to carefully not touch anything to either the inside of the cap or the tip of the bottle because these areas are sterile. Any bacteria that gets on these surfaces can grow in the bottle and contaminate the drops. Some eye drops come in little vials like this, where you twist off the cap. These are usually drops that have no preservatives, and they're designed for you to take a single drop and then throw the whole vial away. Without preservatives, there's nothing to keep bacteria and fungi from growing inside the bottle, so the manufacturers make these single use. Throwing the vial away is recommended and approved by the FDA. But to save some money, some people like to use these droppers more than once. If you're going to do that, here's what I recommend. Keep the top of the vial from touching anything and store the vial with the tip up inside a clean shot glass or other narrow container. Keeping this in the refrigerator will also minimize, but not entirely prevent, contamination. Okay, here's how to take an eye drop. First, tilt your head back as far as possible. Sometimes lying down makes this easiest. If you are right-handed, hold the eye drops in your right hand. Use your left hand to pull down your lower eyelid, which makes a pocket between your lower eyelid and eyeball. This is where you're aiming for the drop to fall. Rest your right wrist on the knuckles of your left hand. This gives your right hand better control and stability. Between the thumb and index finger of the right hand, hold the bottle an inch or more above the pocket in the lower eyelid. Please don't let the dropper touch your skin, the eyeball, or the inside of the eyelid. Squeeze out one drop and let it fall into the pocket. You can do this same maneuver with the other eye. Putting the drop on the forehead or cheek doesn't count, but may happen when you're new to this. If you miss, just try again, and you'll find you can get pretty good at getting the drops in. If you absolutely can't do this, here's another way, not quite as good, but almost anyone can do. Look up towards the ceiling, or lie flat if you prefer, and keep your eye gently closed. Let the drop fall in the little valley around the inside corner of the closed eyelids. Then open your eye and blink a few times. The drop will roll onto the eye. This method is not quite as good because the drop comes into contact with your skin before going into the eye, giving an opportunity for skin bacteria to contaminate the eye drop. Though it's not ideal, this method is usually better than not taking your eye drops at all. By the way, there's never a reason to take any more than a single drop of medicine. The eye cannot hold any more than one drop, so taking more than one is just wasting medication. Some people say they can't always feel when the drop goes into the eye. A good way to make this easier is to refrigerate the drop. You'll feel the cold of the drop on your eye, and it's actually kind of soothing, and although it's not required to refrigerate most drops, it won't do any harm to keep them refrigerated. If you keep drops that are stingy or irritating to the eye, it often helps reduce stinging a lot to keep the drops cold. I hope you find this information makes taking eye drops easier. I'm Dr. Jeff Jacobs. Thanks for watching.